Good morning, everyone. Happy Tuesday. Dr. Steven Zom here with another episode of Tooth Teacher Tuesday. And of course, representing the old shoe today. Colts just finished up their preseason, a very promising looking preseason. So, like every year, very excited to see what the season will bring us. But that's not why you're here. You're here to talk teeth. And so, today we've got another oral pathology corner. Today talking about, I've got a lot of favorite subjects, but probably one of my favorite topics in dentistry, which is something called resorption. And resorption is kind of a complicated topic because we don't fully understand it, but essentially what resorption is a hole that develops in the tooth, not a cavity. It's not being caused by bacteria. It's not from poor oral hygiene. It is something kind of out of our control. It's an oversimplification, but basically what we do know about resorption is that for whatever reason, there's some studies linking resorption to trauma, some studies linking it to moving teeth too quickly during orthodontics, and there's several other reasons that have been proposed for why resorption occurs. But essentially what resorption is the body starts to attack, it's usually just one tooth. It's very rare to see it in multiple teeth. But for whatever reason, the body starts to attack the tooth and create a hole. And it can either be internal resorption, where that hole starts to develop from the inside of the tooth outwards, or it can be external resorption, where the hole starts on the outside of the tooth and burrows its way inwards. And again, we don't fully understand what triggers the body to start attacking the tooth to cause this resorption. And it's kind of a tricky thing, because depending on when it's caught and where it's located and the extent, sometimes it can be treated to prevent further erosion of the tooth, or other times it's just a ticking time bomb. And what I mean by that is, I have a few patients myself that have either internal or external resorption that, if there's going to be any treatment, it's usually a root canal to basically remove the nerve of the tooth and hopefully stop the resorption dead in its tracks. Again, sometimes that's an option, sometimes it's either not achievable or it's too far gone to justify the root canal. And so I've got some patients who we caught it early enough that root canal treated it and, knock on wood, no issues. And others, they've seen the endodontist, the root canal specialist, and they've said, this isn't treatable. And at that point, we just monitor the tooth. Typically resorption is going to be asymptomatic, but eventually if it's not a treatable resorption, eventually that hole is going to break through, and at that point the tooth's going to need extracted. And again, that's kind of a complicated topic. Usually I would show you a picture of what resorption looks like, but it's really only something that can be appreciated on an x-ray, and even then, not insulting anyone's intelligence, but you might not know what you're looking at. So it's not a very visual condition, and it's, again, usually asymptomatic. It's just something that we sometimes incidentally find during your routine x-rays. So yeah, it's an interesting subject, because again, we don't fully understand it. But that's what makes dentistry exciting, is that there's still more to learn, both for the public and for us as dentists ourselves. So Hope you found this interesting as well. Thank you for tuning in, and I hope to see you on next week's Tooth Teacher Tuesday.